In terms of our update here at Southwestern Public Health, there have been now 228 cases of measles reported to our health unit since October 2024. 28 of these have been reported to us in the past week. 19 of all of our cases have been hospitalized at some point. Cases are still predominantly in people who are unvaccinated. And nearly 72% of our cases are those who are 18 and under. I do want to correct an important misconception about immunity through measles infection. While getting measles can result in natural immunity, being infected with measles carries significant health risks, including pneumonia, brain infections, and brain swelling. And for pregnant people, measles can cause low birth weight for the baby, preterm, and miscarriage. A measles infection can also have long-term health concerns after the infection has passed. This can include seizures, hearing loss, intellectual disability, and other lasting neurological problems. Measles-related pneumonia can cause long-term respiratory issues or scarring in some children. And while rare, measles can result in a fatal brain disorder called subacute sclerosing panencephalitis that can develop years after a child has measles. It causes progressive damage to the brain and is not curable. The safest way to become immune to measles is through vaccination. This vaccine has been administered in Ontario since the 1970s and has been a safe and effective way to prevent measles infections for decades. Thankfully, we are seeing the benefit of this firsthand, with very few of our reported measles cases being vaccinated. If this vaccine did not work, we would have a very different case count. Please do not risk your health or your child's health through a measles infection. If you do develop measles, though, please do your best to try to treat the symptoms at home. Stay hydrated to prevent dehydration from high fevers, diarrhea, and vomiting. To treat fever, use the appropriate dose of acetaminophen or Tylenol, ibuprofen, also known as Advil, in children and infants, and follow the instructions. Do not use ASA or aspirin in children, as it can cause Reye syndrome. But do watch out for worsening symptoms such as trouble breathing, constant high fevers, severe cough, drowsiness, or confusion, despite those other attempts, because these worsening symptoms do require medical attention. And remember to call ahead before visiting healthcare centers so that they can be prepared for your revival. For those who have taken action, we want to say thank you. We have had many calls to our health unit seeking advice on how to manage measles symptoms, visits to our measles webpage, and residents have been updating their immunization records, and families are booking vaccination appointments to get their children up to date. These actions matter. This outbreak has been a challenging time for our health unit and for those living in the community. We are grateful for your support and to our staff for their valuable work during this outbreak.